In this session, we will cover ways to monitor pain severity with different assessment tools. We will describe 2 ways of measuring pain severity by self-report and 1 standardized tool for behavioral assessment of pain. Treatment team decisions and unit protocols will determine how often pain should be assessed. For clients who are not reporting pain, don't appear to be uncomfortable, and are not receiving analgesics for pain, it may be sufficient to assess pain only once per shift. For clients who are reporting pain or are receiving analgesic medications, pain will be assessed more often. The frequency of pain assessment depends on the treatment provided and the expected timing of peak treatment effect. Frequency of assessment also depends on the care setting and stability of the client's health condition, as well as the variability of the client's pain. In long-term care homes, asking about pain is one of the 3 questions that all care team members are to ask a client before leaving the room in order to reduce the risk of falls. Pain should be assessed any time a change in medical status has been noted. If a pain treatment, such as a medication, has been provided, baseline and follow-up scores must both be obtained to determine the effect of the treatment. Select a pain assessment tool based on the hierarchy of tools reviewed in Session 4 of this series. Behavioral assessment tools are used to measure pain in clients who are unable to provide a self-report. There is some research to suggest that clients with a modified mini-mental status exam score equal to or higher than 18 are generally capable of providing self-report, but those with an MMSE score equal to or less than 13 are least likely to be capable of providing self-report. However, some people with very low MMSE scores can still provide self-report, so this should always be attempted. It's important to keep in mind that the score from the behavioral assessment tool is not the same as a self-report pain severity score. A self-report of 4 out of 10 on the numeric rating scale may not be the same as a 4 out of 10 on a behavioral assessment tool. This is because the tools measure different things. A self-report tool measures the reported severity of pain, but a behavioral tool measures the numbers or severity of the behaviors displayed by that individual when they feel pain. However, changes in the number or intensity of behaviors observed is thought to reflect increases or decreases in pain. In order to use a behavioral assessment tool, the client must be able to provide a response in each category that's being rated. For example, a tool that assesses body movements could not be used if the client lacks mobility of the part of the body being assessed. The PAINAD, or Pain Assessment in Advanced Dementia Scale, is a behavior assessment tool recommended for use for regular monitoring of pain in adults with advanced dementia who are unable to provide a self-report score of pain. The PAINAD grades the intensity of 5 behaviors between 0 and 2. Use this tool to assess pain during a procedure, such as a blood draw or dressing change, or during assistance with care, such as during transfers or a clothing change. Score each of the 5 items and add the scores for a sum total out of 10. Breathing is rated on its regularity and rate and whether there are periods of hyperventilation. Vocalizations are rated on their frequency and intensity, or the presence of crying. Facial expressions are rated on their intensity. Body language is rated on tension and other behaviors, such as striking out. And consolability is rated on whether or not the client's behaviors settle with gentle touch or reassurance. Use the PAINAD tool to rate this client's pain as her gown is changed.
Hello, Anne. I'm going to change your gown now. Are you ready for that? And I'm going to start on this side with this shoulder, okay? And I know that it hurts you, but I'm going to try to be very careful, and maybe you can help me a little bit. I'm just going to lift your arm. Yeah, okay, very slowly. I'm going to take a deep breath. Yeah. And here's the second one. Yes, you're doing good job, good job, good job. Yeah. Okay, just one more arm. One more arm. Just dip over your elbow there. We're just about there. We're just about there. There you go. There you go. Yeah. There. There, how does that feel? You did it. There. Good job. Good job. Great. You did great. You did a great job, Anne. You did great.
What score would you give the client? At rest, we scored the client at 2 out of 10 for the facial expression and tension in her hands and shoulders. During the gown change, we scored the client at 7 out of 10 for hyperventilation, facial grimace, groaning, tension in her body, and consolability. In the client's chart, we document her pain as 7 out of 10, noting that we assessed pain using the pain ad and during this activity. At the end of this video, we provide links to some excellent online videos of an actor portraying different levels of pain. Use these videos to practice assessing pain with the Pain Ad tool. To summarize, there are several factors that affect how often pain should be assessed. Scores from behavioral assessment tools are not the same as scores from self-report tools, since each method measures something different. The Pain Ad is one of the recommended tools to monitor pain in adults with advanced dementia who cannot provide a self-report score.